my channel. Today I came up with another most repeated topic in NEET PG orthopedics का subject में. It's ankylosing spondylitis. So that is a seronegative spondyloarthropathy and it is HLA-B27 positive and it usually affects young males. The most important things you have to remember is it is mostly seen in young males. So the question gives you it's like a 20 years or some 30 years males, and you find some of the clinical features here that are very significant in making the diagnosis. So you find inflammatory low back pain, morning stiffness, and that pain improves with exercise and it worsens with rest, and you find heel pain, Achilles enthesitis, and you also find loss of lumbar lordosis, reduced spinal flexion, and decreased chest expansion. The most common extra-articular feature is anterior uveitis. So to diagnose that condition, you have to remember these points for sure. So what if it comes in your exam? So just remember these points and you can get with this question. So you do clinical tests here. So before going into clinical tests, the investigations we do here, the early and the most best thing is MRI of sacroiliac joint, and the other things are like x-ray findings late mein we find sacroiliitis and bamboo spine is something normally our spine is little curved bending forward, but in bamboo spine there is like fusion of the spines and there is squaring of the spines, you see that. And Dagger sign is calcification of interspinal processes, and Trolley-track sign is calcification of paraspinal and interspinal processes. So the thing you have to remember is bamboo spine and MRI of sacroiliac joint is the most best and most common investigation you have to do here. And coming to the clinical test, the thing is chest expansion test we do. That chest expansion is decreased here because the ribs are fused with spine, and we also do Gaenslen's test and FABER test and palm handle test. So these are the tests, and you have another most important test is modified Schober's test. So that test we have to do here is you have to mark 2 points 10 centimeters apart in lumbar region, and then you ask the patient to bend forward. Usually when the normal person bends, there will be more than 5 centimeters increase here distance here, but here the distance fails to increase because of the spinal fusion. So at last I'll tell you what are the things you have to remember here. It's a HLA-B27 positive and MRI of sacroiliac joint is the best early investigation, and the classic x-ray finding you see here is bamboo spine, and these are the clinical features you have to remember for sure to diagnose this condition. Now let's get into the questions which are asked very frequently, like what type of questions are asked in NEET PG, and let's see if you guys can solve these things. So the first question comes here. A 20-year-old man presents with inflammatory back pain that is worsening in the morning and improves with activity. He has history of recurrent anterior uveitis. On examination, loss of lumbar lordosis and reduced spinal flexion are noted, and the X-ray of sacroiliac joints is normal. Which investigation is best for early diagnosis in this patient? There are so many clues that is pointing to ankylosing spondylitis, that is inflammatory back pain, worsening in the morning, improves with activity, recurrent anterior uveitis, loss of lumbar lordosis, and reduced spinal flexion. All these are pointing to one condition, that is ankylosing spondylitis. So we have discussed just before what is the best investigation. It's simple, it's MRI of sacroiliac joints. That is the best investigation you do here. Second question here. A 22-year-old man presents with chronic low back pain for the past 2 years. The pain is worse in the morning and improves after physical activity. He also complains of bilateral heel pain for last 6 months. What is the most likely diagnosis? Here also you find so many clues. 22-year-old man, it's a young man. Chronic low back pain, another clue. Pain is worsening in the morning and improves after physical activity, another clue. And he's having bilateral heel pain. So among in view of all these clues, I am giving this as ankylosing spondylitis. Sometimes they may give the x-ray of bamboo spine or trolley-track sign or dagger sign, and they can also ask you. So these are the very few points you just have to remember to get your question right, and this may make your difference in the NEET PG of choosing your branch. So guys, if you find this video helpful, please like, share and subscribe. Thank you.